Good morning, everyone. I am Dr. Namrata Singhal Sawant. I still remember the first patient that changed the way I looked at medicine. I was just 10 years old, and she was my grandmother. We were told she had recovered completely from her breast cancer. But there she was, lying on the bed with a big belly, suffering from jaundice. The cancer had silently returned. That day, I decided what I wanted to do with my life. Many years forward, I meet this young lady, just 27 years old, engaged, about to get married in a few weeks. She had noticed a lump in her breast few months ago, but she never discussed it with anyone, thinking, I am too young to get cancer. It was. That day, I realized something big. Awareness and early detection can save lives much before the treatment ever will. Because by the time we treat, the battle has already begun. Breast cancer these days is the most common cancer in women worldwide. According to data by WHO 2020 and 2022, there are approximately 2.3 million new cases of breast cancer in women worldwide. In India itself, according to data by Indian Cancer Medical Research ICMR and Globocan 2020, every 4 minutes a woman is diagnosed with breast cancer, and every 8 minutes a woman loses her life to breast cancer. So that means by the time I finish my talk, somewhere in India, a woman would have lost her life to breast cancer. The problem is, more than half of the ladies, they come in at late stages. Not because they didn't care, but because they didn't know. Awareness still hasn't reached where it is needed the most. Awareness still hasn't reached where it is needed the most. And the problem around breast cancer is not the treatment itself. It is the silence around it. In our culture, words like breast and cancer, they are hushed, silenced, whispered. People avoid using these words, and they do not want me to use the word cancer even when I want to reassure them that you do not have cancer. This sometimes reminds me of Voldemort from Harry Potter, he who must not be named. But silence can be deadly. I remember this lady from a financially well-off family. She had this lump which she carried for years in her breast. She never discussed it with anyone because she thought it is little uncomfortable to discuss with anyone and it doesn't pain me. So by the time she came to us, her breast was almost like a big dark ball. Her words are clearly etched in my memory. She told me, I take care of everyone, but I forgot to take care of myself. Self-care isn't being selfish. Self-care is survival. We cannot pour from an empty cup. And awareness doesn't have to be complicated. It is 3 simple steps. Know, check, act. Know how your breasts normally look and feel. Check once in a month. According to National Breast Cancer Society, and it is recommended by National Breast Cancer Society that look yourself in the mirror once in a month. For the ladies who are getting their periods, they can check on day 7 to 10th of the month, or for menopausal ladies, they can fix a date like 1st or 15th of every month. Check for any skin changes, thickening, nipple discharge, dimpling, any lump which they might feel in your breast or even in the armpit. And step 3, act. If you find some changes, do not panic, but act immediately. Show to your doctor. Get that screening mammogram if required. And of course, follow your local screening guidelines, because according to American Cancer Society and SEER database, when detected early, especially at stage 1, the survival rates are the highest. And the good news is, medicine is evolving faster than ever. Now we have targeted therapies which target only the cancer cells. Hormone therapy for hormone-sensitive cancers. Genetic testing for genes like BRCA1 and BRCA2, where we can diagnose the high-risk women much before the symptoms appear. Mammography these days are nearly painless, faster, more accurate and safer. Surgeries these days focus mainly on breast conservation and reconstruction. The question is no longer, how long can I live, but how well can I live? Every survivor I meet teaches me something new about courage. After their treatment, they go back to their family, their careers, and their smiles. And then they come back to help others through this journey. They have turned their pain into purpose. And when a woman gets affected by breast cancer, her entire family feels it. But when the family stands by her, her recovery becomes much faster. And to all the men in this room, yes, you too can get breast cancer, although rarely. And I want you all to encourage the women you love to get that screening mammogram done, get that preventive health checkup done. Just ask your women how they are feeling. Normalize these conversations. As a society, we must stop whispering and start talking in school, colleges, workplaces, homes, because breast cancer doesn't discriminate, but awareness can save everyone. I see women walk into my clinic terrified and walk out months later with smiles, scars, and stories of survival. So if there is one message I want you all to take home today is, breast cancer is not a death sentence. It is a wake-up call, a call to care, a call to check, and a call to cherish life more than ever. So let us make a promise today. I will listen to my body. I will encourage the woman I love to get screened. And I will normalize these conversations about breast health. Because early detection doesn't just find cancer early, it finds hope early. Thank you.